All right. My name is Marissa Hill. I am a family nurse practitioner student at Maryville University. This is my head-to-toe assessment video for my advanced health assessment class. This here is Ricky. He has volunteered to be my patient for today, and so he'll be assisting me throughout this exam. Prior to beginning, I was able to complete my hand hygiene. I was able to obtain a full set of vitals. I was able to get a height and a weight. I was able to assess his distant vision with a Snellen chart. I was also able to have him empty his bladder and put him into a gown, but for the purposes of today, he has opted to wear shorts. All right, so we're going to start with the assessment of the head and the face. We're going to start with that general inspection, just making sure that his eyes, his nose, his mouth, his ears are all symmetrical and lined, even his eyebrows. We will also take note of his skin color, noting that it is within normal limits for his ethnicity and his age. We are also inspecting the skull at this time, noting that it is nice and round, normal cephalic, and then we can just go ahead and go on to palpating the skull. So as we palpate, we're going to note if there's any nodules. Take note of the scalp, no nodules, no masses, no bumps. The scalp is not dry. The hair is evenly distributed. There's no areas of alopecia. So those are all normal findings. We're going to go ahead and come down and palpate the facial bones and the frontal sinuses along with the maxillary sinuses as well. So we're going to be looking for any tenderness, any pressure, any fluid buildup. Those would all be abnormal findings. He doesn't seem to be experiencing any of that, so that is within normal limits. We're going to go ahead and take the time to assess his temporal mandibular bone. So I'm going to have you open your mouth and close and move your jaw side to side. All right, and there's no clicking, no popping, or anything of that nature, so that is within normal limits. So now we're going to go ahead and move on to assessing cranial nerve number 5 with the light sensation. So we're going to touch his face on several different areas on each side, make sure that he can actually feel those, know where I'm feeling, where I'm actually touching, and that it feels the same on both sides. So I'm going to touch here. I'm going to touch here.
Yes.
Here.
Yes.
Here.
Yes.
Here.
Yes.
Here.
Yes.
All right, and so cranial number 5 is intact. So now we can go ahead and move on to assessing cranial nerve number 7, which would involve him going through 6 motions of his face. I'm going to have you close your eyes real tight, wrinkle your forehead, clench your teeth, smile, stick out your tongue, and puff out your cheeks. All right, so now cranial nerve number 7 is intact. So now we're going to move to the assessment of the eyes. We're going to just do that generalized inspection, make sure that everything looks like it's aligned and it's symmetrical, and then we can go ahead and move on to palpating. So we're going to palpate that lacrimal apparatus and make sure there's no drainage or anything like that. Then we'll pull down to actually visualize the conjunctiva, make sure it's nice and moist and pink. Okay, so I'm going to palpate the eyes. And I'm actually going to use the light from the otoscope because my pen light broke shortly before the video, and I'm just going to pull down that conjunctiva and take a look inside those eyes, make sure that it's nice and pink. All right, pull that down, and looks good. Pull it down, and looks good. So everything looks good there. And I'm also going to go ahead and check his pupillary response. I can even move on to the ophthalmoscope to also check for the REDS test as well. So we'll do those 2 right now. So I'm going to hold this. I want you to focus on an object there. And I'm going to put the light in. And good. And good. All right, so what we're assessing for is to make sure that those pupils are equally round, that they react to light, and that they accommodate. Those would be a normal finding, and his pupils did do that. So I'm going to go ahead and move on to the ophthalmoscope and make sure that we check for the REDS test. All right, so I'm just going to place this by looking for that red response. If you get something that looks white, that could be a sign of like a retinoblastoma. That is an abnormal finding. So and I did actually get that red response, so that is a normal finding. So now we're just going to move on to checking his visual fields and his ocular movements. So what I'm going to do is have you focus again on an object out there, and then I'm going to have you cover your right eye. Okay, and then cover your left eye. Okay, so we're checking for like any jerking or movement or anything like that. So now we're going to go ahead and check his visual fields. And so I'm just going to take my hands on the side and pull them forward and check that peripheral vision. And you're just going to let me know when you see my hands, okay? So I'm going to come on here.
See it.
All right, and here.
See it.
Okay, and that is cranial nerve 2, 3, 4, and 6. So next we're going to move on to the assessment of the ears. We're going to start like we do every other assessment, check with that inspection, check the skin, and then we'll move on to palpating. So we're going to palpate the auricle and the earlobe, noting that it's freely movable. There's no lumps or nodules or anything that we need to be aware of there. Those are within normal limits. So then we're going to go ahead and I'm going to do the whisper test to test cranial nerve number 8. So I'm going to stand behind him, actually whisper 2 common words and see if he can hear them.
Apple. Orange.
All right, and cranial nerve 8 is actually intact. So now we can move on to doing the Weber test and the Rhines test. So with the Weber test, we're just going to strike the tuning fork, place it on top of the head, and make sure that he can feel equal vibrations on both sides of his face and his ears. Okay, so we're going to tap that. Equal?
Yes.
Okay, and then we're going to move on to the Rhines test, which actually tests air conduction versus bone conduction. There should be a 2-to-1 ratio there. So we're going to go ahead and tap it and place it on that mastoid bone. Let me know when it disappears.
Couldn't feel it.
All right, let's try again. It's because I'm holding it. There you go.
Couldn't feel it. There you go. One way.
Okay, let's try again.
There it is. One way. One way.
Okay, and you want to make sure that that is a 2-to-1 ratio again. So now we can go ahead and move on to the assessment of the nose. You're going to do that same general inspection, make sure that it's aligned, make sure the septum is aligned, there's no deviation or anything like that. I'm going to take the light from the otoscope again and go ahead and assess the nostrils, and then we'll test for the patency. So let's turn this on. Alright, I'm going to take a look up, and it's nice and moist. Septum is in place, there's no deviation or anything like that. So now we're going to test for the patency. This is cranial nerve number 1. You could, also test for the smell too. That would actually be the complete cranial nerve number 1 assessment, but we're just going to test the patency right now. So I want you to occlude your right nostril. Occlude it. Breathe in. Okay, and do the other side. Breathe in. Okay. Did you have any trouble breathing?
No.
Okay, so there's no obstruction, and that means cranial nerve number 1 is intact. So we're going to move on to the inspection of the mouth and the pharynx. So we'll do it the same way as we have. We'll start off with that general inspection. I'm going to use the light from my otoscope again just to go ahead and look inside the mouth. We're looking at the lips as well to make sure they're nice and pink. There's no blue or gray. There's no sign of cyanosis or anything like that. So I'm going to go ahead and have you open your mouth. And we are looking to make sure the mucous membranes are nice and pink and moist, and they are intact. There's no nodules, no lesions. I can see the tonsils. Say ah.
Ah.
And that uvula rises with that soft palate. I can see the hard palate, and I also can see that posterior pharynx whenever he does say ah. And also we would use that tongue depressor, and we will have him stick his tongue out to check the gag reflex. That is also assessing cranial nerve number 12. All right? Okay. Okay, so now that we have completed the assessment of the mouth and the pharynx, we can go ahead and move on to the assessment of the neck. We're going to do the same thing. We're going to make sure that we inspect it and that it is in normal alignment. The neck is supple, the skin is warm, it's dry, it's intact, and it's normal for his ethnicity. And then we'll go ahead and palpate. We'll make sure we're also looking for any signs of jugular vein distension, and we can also do some range of motion before we palpate. So I'm going to go ahead and have you tilt your neck to the right and to the left and forward and backward. Okay, good. That all looks good. And what I'm also going to do is push down on your shoulders, and I want you to try to resist, okay? So push up against my hands. All right, good. So I'm going to go ahead and palpate that neck, make sure it's nice and smooth, and then we'll go ahead and go through those lymph nodes as well. So we're going to start up here with the preocular, and we're going to go back to the postocular, and the occipital, and down to the trachea, and down to the deep cervical, and the posterior cervical, the anterior cervical, and down into the clavicular. I'm sorry if I'm tickling you. And down into the infraclavicular. And we're going to go ahead and palpate those axillary nodes as well at this time, okay? And what you're going to look for is to make sure that those are freely movable, they're soft, they don't feel rubbery, they don't feel hard. That could be a sign of malignancy, so that's what we're looking for there. I'm also, while I'm checking his neck, I want to go ahead and palpate that thyroid and also the trachea, have him swallow. That assesses cranial nerve 9, 10, and 11. And so we'll have him swallow, make sure everything stays in alignment. There's no tracheal deviation. That could indicate an abnormality within the thoracic cavity, so such as like a tension pneumothorax or something of that nature. So we're going to go ahead and palpate. Everything is aligned. There's no deviation. And I'm going to go ahead and have you swallow. And everything rises and still stays in alignment. So that would all indicate normal findings. Okay, so now we're going to go ahead and move on to the posterior back and chest and lungs. So I'm going to go ahead and have you hop down into this chair, and I want you to face with your back toward that way. Okay, so we're going to do a general inspection. So we're looking at the skin, making sure that everything is nice and symmetrical, it's even, that the skin is warm, it's dry, it's intact, the configuration is normal. So then we're going to go ahead and palpate. And I'm going to take this time to go ahead and assess that tactile from interest and have him say 99. So say 99.
99.
99.
99.
99.
99.
Okay, and so that would be a normal finding if there's not any abnormal vibrations or anything of that nature. So I'm going to go ahead and percuss in a nice symmetrical manner. Listening for any dullness or hyperresonance. Okay, and those are all within normal limits. So now that we've completed the inspection, I'm just going to watch the expansion here. I'm also going to go ahead, we could actually assess for the diaphragmatic excursion. So what we're going to have him do here is we're actually going to have the patient take a deep breath, and then he is going to let that breath out and then hold, and then we're going to percuss until there's a sound change, and then we will make a mark. And then we will have him take another deep breath, and instead of letting that breath out, he's actually going to hold that breath, and we'll percuss again until we get that sound change, and then we'll make another mark. A normal finding would be between 3 and 5 centimeters, but in a patient that is well conditioned, it could be up to 5 to 7, okay? So what I'm going to do is have you take a deep breath. I want you to let it out and hold. Okay, I'm going to make that mark. Okay, so I just wanted to have you take a couple normal breaths, and then I'm going to have you take another deep breath when you're ready, and then you're going to hold before you exhale, okay? All right, so when you're ready, take a deep breath and hold. All right. All right, so we're making that other mark here. And if we know, we can measure with our tape measure. note that that is probably about 3 centimeters, so that's within the normal finding, okay? So now that we've done that percussion and that diaphragmatic excursion, we're gonna go ahead and auscultate those posterior lung sounds, and then I'll have him go ahead and turn around and we'll do it on the anterior side as well, okay? So I'm gonna go ahead and do this in a symmetric motion. I'm listening to make sure the lungs are clear throughout. There's no crackles, no bronchi, or no rales, or coarse, or wheezes heard. Take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Gonna go ahead and auscultate the lateral side. Deep breath. Okay, and those lungs are nice and clear, no coarseness, no rales, no wheezes, or anything of that nature, so that is a normal finding. So we'll go ahead and have him turn around and we will assess the anterior chest, and we'll go ahead and listen to the lungs. We'll do the inspection, listen to the lungs, and then listen to the heart sounds as well. When we inspect, we're going to look for that accessory muscle use, that normal rise and fall of the chest, that he's not really working to breathe, okay? So we can also do that palpation on this side to assess for that tactile fermentus, and we'll do that by having him say 99 again. Say 99.
99.
99.
99.
99.
99.
Okay, and again, that is within normal limits. So now what we can do is go ahead and listen to those anterior lung sounds, make sure that they are clear just as they were on the posterior side. And while I'm going ahead and auscultating, I'm going to go ahead and auscultate the carotids, and then I'm also going to do the heart sound as well, okay? So we're going to start up here with the bilateral carotids. You can breathe normal right now. You're good. Okay, we're going to start with the aortic and the pulmonic and the Erb's point and tricuspid and the mitral. And we're listening for that normal S1, S2, that lub-dub. Make sure there's no murmurs or anything of that nature. And so that was all within normal limits. So now that we have assessed the heart sounds, we'll go ahead and have him step back up onto the table so that I can do his abdominal assessment. Sorry. Go ahead. You can lay down whichever way you want.
Okay.
Okay. All right, so I'm going to do that general inspection of his abdomen. I'll just use this light again. We'll be checking that contour and making sure there's no pulsations. Pulsations that occur in the abdomen could usually be a result of from that aortic artery. Could be a result of like a AAA. Make sure there's no nodules or hernias as well, no masses. So everything appears to be okay. Let's take this light. Okay, and again, the skin is, warm, it's dry, it's intact, it's within normal ethnicity. So now what we're going to do is just go ahead and auscultate those bowel sounds in all 4 quadrants and make sure that we could hear them. We listen for up to 2 minutes, and anything above 2 minutes without hearing bowel sounds would actually be considered an abnormal finding. So we're going to go ahead and take a listen. Okay, and he has good vowel sounds throughout. So now we can go ahead and move on to percussing that liver and that spleen. We've got that liver on the right side, and then we've got that spleen over on the left side. So we're going to just do some percussion and listen for any dullness or hyperresonance. Okay, and now that we've percussed, we'll go ahead and palpate that liver and that spleen. So we're going to palpate here. And honestly, the normal finding is that you probably would not. We'll start with light palpation and then move into the deep palpation. Okay, going to move to the other side. Okay, and I'm not feeling anything abnormal, so I'm going to actually use like the duck bill technique to go ahead and palpate for those kidneys on each side. Again, ideally you probably really won't feel anything. So we're going to palpate. And I'm going to come around on the other side and palpate again. Okay. All right, so now that we have finished the abdominal assessment, I am going to go ahead and have you sit up back on the edge like you were before. Okay, and so we'll go ahead and do the assessment of the upper and the lower extremities, and I like to kind of group the upper, the lower, and the musculoskeletal all together because they kind of go with each other. So we'll start by a general inspection of the arms, and we're looking at the skin, making sure it's warm, dry, it's intact. We're going to come down to the hands and the fingernails, make sure those nail beds are nice and pink and that the capillary refill is less than 3 seconds. There's no signs of cyanosis or clubbing or anything of that nature, so that's all within normal limits. So now what I'll do is just test his strength, have him put his arms out, and I'm going to have him resist against my hands. So I'm going to push down, you're going to resist up, okay? All right, and same the other way. All right, so that's good there. I'm also going to palpate the pulses, the radial and the brachial on both sides. Make sure those pulses are nice and strong and they're not weak, but they're not bounding. All right, so I'm going to palpate here. Palpate here. And honestly, as I palpate these radial pulses, I typically have a tendency to go ahead and listen to those heart sounds again to make sure that they're actually synchronized and there's no irregularity between the beat of the heart and the pulse that I feel in the radial pulse. So I'm going to do the same here. Okay, and they're nice and synchronized. Those pulses are nice and strong. I'm going to check his brachial over here. And that is nice and strong. So I'm actually going to go ahead and check his reflexes and his brachial and his radial. All right, so just relax. Here. And turn over. And here. And turn over. And here. And here. All right, and those are all within normal limits. So then we're going to go ahead and move down to the lower extremities and the legs and the feet. Again, we're doing that generalized inspection, looking at the skin, making sure it's warm, it's dry, it's intact. The hair distribution on the legs are nice and even, pretty comparable bilaterally. I'm actually going to assess the pulses on the feet. So we've got the pedal and the posterior tibial. Make sure, again, those pulses are nice and strong and palpable, but not bounding and not weak. Okay, good. Okay, good. And then we're going to go ahead and check those reflexes and the popliteals, okay? All right. All right. Okay, and the last thing we're going to do to kind of round out this assessment is the musculoskeletal, which is just the alignment of the cervical and the lumbar spine. So I'll actually have you hop down again. I'm just going to have you stand up and face the window, and then I'm going to have you bend over and like you're going to touch your toes so I can just check the alignment of your spine, okay? All right, so just making sure that that spine is nice and aligned. As you can see, there's no deviation in the spine, no evidence of any scoliosis or lordosis or kyphosis, so that would be a normal finding. So, okay, you can go ahead and stand up. And that actually concludes the exam. Thank you. That's the end of the exam.